In cooperation with the Robert Koch Institute, Maisha carried out a study on the subject of sexual health of migrants from sub-Saharan Africa, STIs. The study, known as MISA, was completed in 2017 and led to awareness campaigns in many African communities. With the support of the Frankfurt am Main Health Department, Maisha continued this work in 2018 with the Be Clever, Be Safe campaign. This program provides information about sexually transmitted diseases and is used for giving information to ensure good sexual health of the African community. Sexually transmitted diseases. 1. HIV/AIDS. 2. Zika Virus. 3. Hepatitis. 4. Gonorrhea. 5. HPV, Human Papilloma Virus. 6. Chlamydia. 7. Condylomata acuminata. 8. Bacterial Vaginosis. 9. Trichomoniasis. 10. Syphilis. 11. Genital herpes. 12. PID, pelvic inflammatory disease. 13. Ulcus mole. HIV/AIDS. Infection risk. When body fluids, blood, semen, vaginal fluid come into contact with wounds or mucous membranes. Very risky sharing syringes in drug use. Most common route of infection is unprotected intercourse. HIV-positive women can transmit HIV to their child at birth or while breastfeeding. This risk can now be eliminated almost completely. Prevention. Inform about the HIV test. Practice safer sex. Condoms protect during sexual intercourse. Do not share syringes for hygienic conditions. Project Be Clever, Be Safe. Zika virus. Zika viruses are transmitted by mosquitoes of the Aedes genus in most cases. It can be transmitted sexually by men. So far, it is unclear how long the virus can survive in semen. Partial transfers even after the symptoms of an infection have subsided in men. Genetic material of Zika virus has also been detected in urine and saliva. Whether the Zika virus can be transmitted through urine and saliva is currently unknown. Risk. For pregnant women, infection is dangerous because the virus can spread to the unborn child. Symptoms. Infection occurs with or without attenuated flu-like symptoms. Skin rash, headache, joint and muscle pain, inflammation of the conjunctiva, and fever are most commonly reported. Often those affected have no symptoms, asymptomatic course. Prevention. Use a highly effective insect repellent. Wear long, light, and possibly impregnated clothing. Use impregnated mosquito nets when staying in non-air conditioned rooms. Attention! The infected mosquito species stands out especially during the day, not only at dusk. Use condoms during sex, especially if you're pregnant and your partner is returning from a Zika area. Hepatitis. Inflammation of the liver. Information on prevention. How does the virus spread? For hepatitis B, hepatitis D, and hepatitis C, is spread through blood, semen, and other body fluids. For hepatitis A and hepatitis E, this is spread through lack of food hygiene, contaminated water, and lack of sanitation. How do I protect myself from hepatitis? Get a test and the vaccine for hepatitis A, B, D, and E. Talk with a doctor before giving birth about how to prevent transmission to newborns. Peel your fruits and vegetables, cook your food properly, and boil your water before drinking it. Wash hands regularly. Use only sterile razor blades and hypodermic needles. Use safe sex condoms. Gonorrhea. Gonorrhea is one of the most common sexually transmitted infections. The disease is caused by bacteria, the gonococci. They can affect all mucous membranes, typically the urethra, but also the rectum and the oropharynx. Symptoms. Infections of the genitals lead to complaints in just under half of women and in about 90% of men. Characteristics are purulent, often foul-smelling discharge, and pain when urinating. What are the risks? Even with a regression, an untreated gonorrhea can continue to spread in the body and cause consequences to fertility. Therapy. The disease is treated with antibiotics. Prevention. Use of condoms. Human papillomavirus, HPV, is sexually transmissible and responsible for cancer of the throat and the genitals, especially cervix and or penile cancer. 8 to 15 out of 100 in the age group of 20 to 30 are infected with HPV virus. Symptoms. Infection of the mucous membranes often remains unnoticed when the immune system successfully fights the pathogens. Cancer can develop from the inflammation. Diagnostics. HPV tests by doctors. Prevention. A vaccination can protect against infection with some major types of viruses. 8 out of 100 of all age groups are infected by HPV virus. It is important to get informed about the human papillomaviruses and their possible consequences by a doctor. Chlamydia. Inflammation of mucous membranes. Chlamydia is one of the most common sexually transmitted diseases. Symptoms, often no complaints. Symptoms. After 1 to 3 weeks, urethral discharge, itching, and burning, as well as painful urination. An untreated infection can spread throughout the body. In men, the spermatic duct, prostate, and epididymis can become inflamed. In women, the infection can migrate into the abdominal cavity and also affect the oviduct. Risk. In some cases, an untreated infection leads to infertility. Therapy. The disease is treated with antibiotics. Prevention. Use of condoms. Condyloma acuminata, genital warts. Genital warts are one of the most common sexually transmitted diseases in addition to genital herpes and chlamydia. Symptoms. Genital warts are often symptomless. Moderate itching and minor bleeding can rarely occur. It can happen as single wart or an accumulation of nodules, which are difficult to see. Genital warts often grow cockscomb or cauliflower-like, reddish, gray, brown, or whitish in color. Women and men are about equally affected. Therapy. In early stages, curable with ointment. Later, a surgical procedure may be necessary. Prevention. Use of condom. Prophylactic vaccination. Bacterial vaginosis. Among women, it is the most common disorder of the vaginal flora by bacteria. Risk factor. It can be transmitted through sexual intercourse. Symptoms. Often a gray-white, thin or foamy vaginal discharge occurs. Rarely occurring is redness in the genital area, itching in the genital area, pain during intercourse, or pain when urinating. Prevention. Vaginal hygiene, regular checkups at the gynecologist, use of condoms. Therapy. The disease is treated with antibiotics. Trichomoniasis, sexually transmitted disease. Symptoms. The first symptoms usually go away after 1 to 3 weeks. It comes to purulent inflammation of the mucous membrane of the sex organs of women and men, often with itching, burning, and unpleasant smelling vaginal discharge, bacteria in vagina, prostate, urethra, and penis foreskin. To avoid the ping-pong effect, a drug therapy of the sexual partners is necessary. Therapy. The diseases are treated with antibiotics. Prevention. Use safe sex condoms. Syphilis. Syphilis is a chronic infectious disease that is sexually transmitted. Symptoms occur in 4 stages. Stage 1. Painless knot at the area of the infection. Stage 2. Spread through blood throughout the body. Skin and mucosal changes. Scaly or purulent vesicles. Sometimes fever, head, muscle, or joint pain. Stage 3. Infestation of organs. Destruction of muscles and skin. Affected may be bones, nervous, and cardiovascular system. Stage 4, called neurosyphilis. Meningitis with blood vision can occur. Brain tissue dies, which can lead to memory loss, paralysis, and dementia. Even destruction of the spinal cord, known as tabes dorsalis. Prevention. Condoms protect, but not 100%. Disease can be transmitted through kissing, so better not have sexual contact with alternating or unknown persons. Therapy. The disease is treated with antibiotics. Regular medical checkups is necessary. Genital herpes is a viral infection, among others, the most common sexually transmitted disease. What are the risk factors? Sexual contact with infected persons, contact with sperm, saliva, vaginal or prostatic secretion. Symptoms. The infection occurs without symptoms or only after a long incubation period. It can also appear by itching. Risks. Infection can be very dangerous for newborns. Therapy. It is important that sexual partners of infected persons are also examined and treated. For treatment, antiviral medicine and symptoms reducing measures are used. Prevention, safe sex use of condoms. Get informed about the disease. PID, pelvic inflammatory disease. Pelvic inflammation is a serious infection of the uterus, fallopian tubes, or ovaries. Symptoms. The most common symptoms are pain in the pelvis and lower abdomen, vaginal discharge with unpleasant odor, nausea and vomiting, pain during intercourse, fever and chills. Risks can lead to infertility. Tissue of the fallopian tubes can be scarred. Blocking of the fallopian tubes. Risk factors, often among women under 25 years. Alternating sexual partners. Therapy. The disease is treated with antibiotics. Prevention. Use of condoms. Ulcus mole is a sexually transmitted disease. Symptoms. Ulceration ulcers form in the genital area, which are soft and painful to touch. In a gynecological or urological examination, the pathogens must be detected. Therapy. The diseases are treated with antibiotics. Prevention. Use safe sex condoms.